Welcome to the Thinking Practitioner Podcast.
A podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Till Luca.
Welcome to the Thinking Practitioner.
The Thinking Practitioner podcast is proudly supported by ABMP, Associated Bodywork and Massage Professionals, the premier association for dedicated massage and bodywork practitioners like you. When you join ABMP, you're not just getting industry-leading liability insurance, you're getting practical resources designed to support your career. From free top-tier continuing education and quick reference apps like Pocket Pathology and 5-Minute Muscles, ABMP equips you with the tools you need to succeed and grow your practice. ABMP is committed to elevating the profession with expert voices, fresh perspectives, and invaluable insights through CE courses, the ABMP podcast, and Massage and Bodywork magazine, featuring industry leaders like my co-host Whitney Lowe, myself, Till Luca, and the Thinking Practitioner. Listeners like you can get exclusive savings on ABMP membership at abmp.com/thinking. Join the best. Expect more from your profession. And you've heard us talk about Jane before, and we keep mentioning them as a sponsor for a reason. We're selective about who we partner with. We want sponsors whose values align with ours and who genuinely serve this community. Jane fits that bill. They're a practice management platform built specifically for health and wellness practitioners. Simple enough for solo practitioners, but powerful enough for clinics and groups. What really caught our attention is Jane's reputation for customer service. Real humans available by phone, email, or chat, even on Saturdays. That kind of support is increasingly rare, and it says a lot about a company. If you're looking to simplify the business side of your practice, check them out at a-t.tv/Jane. And Thinking Practitioner listeners can get a free first month by entering Thinking1MO. That's Thinking1MO at checkout. Welcome back to the Thinking Practitioner. I'm Till Luca, and today we're turning towards something that sits underneath almost everything we do as bodyworkers, but that we rarely name out loud, the topic of affection. The simple, profound human need to be touched, cared for, connected to. My guest is Dr. Kory Floyd, professor and chair of human development at Washington State University, and one of the world's leading voices on affection and human connection. His research blends communication, evolutionary biology, and physiology to show how affectionate touch shapes our health and what happens when we don't get enough of it. He created affection exchange theory and wrote The Loneliness Cure, along with more than a dozen other books. And his work makes the striking case that affection isn't a luxury or a nicety, it's a biological need with measurable consequences for our health when we don't get enough of it. And I'll be honest with you about the personal aspect of this. As I've talked about before here on the podcast, I lost my wife of nearly 40 years to cancer in 2024. And just a few months ago came through a difficult romantic breakup. So these experiences have given me a really personal, acute appreciation for the role that our work and affection and the relationships we have with each other, the role those can play in our clients' loneliness and loss of affection. I think all of us can think of clients who come to us because of the human connection first and foremost, besides whatever physical or other complaints they may be seeking help with. So I'm looking forward to thinking about that larger topic out loud with you all and with my guest. Kory, welcome. It's good to have you here.
I'm delighted to be here. Thank you.
Maybe we'll start at the foundation. So what does affection deprivation actually do to a person physically, emotionally, etc.?
Yeah. Well, I've conceived of the idea of affection deprivation as that distance between the amount of affection that we feel like we need in our lives to be happy and to thrive, and the amount of affection that we actually receive. And if you're lucky, there's no distinction between those at all. You get the amount of affection that you need. You feel fulfilled in all of the things that that does for us physically and emotionally and psychologically. But for many people, that isn't the case. They wish they had more affection in their lives. They feel deprived of those behaviors, hugging, touching, kissing, verbal behaviors, expressions of love that...
How widespread is that, do you think? What do we know about how common that
Well, we've
is?
done We've done some population surveys in the United States, at least, and found that it's around about 40% of people report that they don't get enough affection in their lives, or they don't get the amount that they wish they did.
Interesting. And I would imagine that varies with demographic and age. Is age a factor? Speaking
Age
here
is
from middle 60s. Yeah.
surprisingly, gender is not, education is not. Age tends to be the primary predictor. Yeah, you're absolutely right. Even geography is not a predictor. So it doesn't really matter where you are in the country, you're sort of equally likely to experience it.
And so back to what it does to us. What's the big picture's description of what actually happens when we have that deprivation going on?
The primary thing it does to us is it makes us feel less safe in the world. We feel less connected to other people, and therefore we feel less of that sense of safety that we have when our relationships are strong, when we have a solid attachment base to other people. And so when we're deprived of affection, particularly if we're significantly so, then we feel a real sense of vulnerability in the world, and we may become hyper attentive, we may become hyper vigilant to our safety, see threats in our environment when they aren't actually there. And that can have really profound effects on things like our ability to sleep or the ability of our immune system to function properly.
So a lot of people come to body workers. I'm still just digesting that 40% number and the idea that age being a factor means that probably more than 40% of our older clients are going to be having some kind of gap between what they'd like and what they're getting.
Sure.
So a lot of people come to us seeking affection without ever naming it, I think. That's my theory. And how does your research support the idea, or doesn't it, that touch from a practitioner in like a professional setting can meet that need, continually meet an affection need?
There's a fair amount of research on, at least on massage therapy, that shows that it has some beneficial effects on our sense of loneliness, our sense of connection. And certainly it can help with a lot of the um, physiological effects that tend to go along with affection deprivation, things like sleep quality, immunocompetence, reduced chronic pain, things like that. But I think that to some extent, not to an absolute extent, but to some extent, the body doesn't really differentiate between touch received in the context of a close interpersonal relationship and touch received in the context of a professional relationship. Now, our mind can differentiate those, of course. I know when I go to get a massage that that's not the same kind of touch that I get from an intimate partner. But to some extent, the body doesn't make that same distinction. And the good news in that is that we really can benefit in a lot of the same ways as long as we feel like we are receiving that touch in a safe environment.
The body doesn't differentiate, you're saying. Touch is touch.
To some extent, it doesn't.
Because we're learning so much about contextual effects of our
Right.
interventions and how much setting the stage and creating expectancy, all that kind of thing, leverages what we do. But you're
There's
saying
a
there's
a decent amount of research that shows, take the example of stress, that if I'm going through a stressful experience, like maybe I'm a child and I'm going to the doctor to get a shot, right? Very stressful experience for many kids. Many kids want to hold somebody's hand during that time. And there's an analogy, I think, to the way that adults deal with stress there. And research shows that it is more beneficial to hold the hand of a parent or somebody that we care about than it is to hold the hand of a stranger. However, it's still more beneficial to hold a stranger's hand than nobody's hand.
I get it.
To some extent, those effects are additive. It's better if the touch comes in a close relationship, but some touch, as long as we feel safe with it, is better than no touch.
I want to dig into the specific effects of deprivation. And your story about holding the hand made me think of a workshop I was in recently about free diving, going underwater while holding the breath. And we were practicing on land, lying on our backs, relaxing, holding our breaths. And we did it. And then she said, okay, just hold the hand of someone nearby. And we didn't even look to see whose hand we were holding. It was just somebody. And the time that we could hold our breath was measurably longer in that context. Just that sense of like, I can be with this breath holding. I got someone's
Mhm.
in my hand.
Yeah.
So uh, let's tell us a little more about those effects. That's just fascinating. You mentioned sleep deprivation, stress resolution. What are the other effects of that?
Yeah, there's a fair amount of overlap actually between the effects of affection deprivation and the effects of loneliness. So conceptually, they're quite similar. And I'll go back to that idea that when we feel disconnected from others or when we feel like we're not getting the affection we need, we feel more vulnerable in the world. We feel like the world is a more dangerous place. So that hypervigilance that causes us to see threat where it doesn't exist, or to interpret ambiguous signals like a facial expression as more threatening than they actually are. That's a form of stress, a form of chronic stress that we sort of carry on our shoulders that entire time. And anyone who knows anything about stress knows it has far-reaching both psychological and physiological effects on the body. It's a very detrimental kind of experience to hold in a chronic sense because it affects our ability to function properly, to digest properly, to sleep properly, to heal from wounds. We don't heal from injury as quickly. And not to mention the psychological effects. Of course, we feel more distress. We feel more less able to regulate our emotions in stressful situations. It has relational effects. Of course, it can contribute to um, prolonged conflict, for instance, or prolonged disengagement emotionally from a relational partner. There's almost nothing about affection deprivation that is positive.
Wow. And you said it's comparable to loneliness. A lot of the same things apply. Uh, you mentioned stress as the common factor in so many issues and complaints, and certainly we're very aware of that in our field, including pain and
Mhm.
chronic pain. Stress being a contributor to that, but also the pain response itself. One way to conceptualize it being a protective threat threat handling, threat coping response. So this has lots of implications. Uh, we spend a lot of energy in our field in the education process, but in the certification process too, with caution, carefulness, boundaries around affection. It's really important that this be handled in a way that is beneficial and not a threat to our clients, because these are very human things that are in our field. All that caution and care is necessary, but what if we switch the lens a little bit and to think about what we're good at, not what we need to be careful about? How do we really own the power of what we offer without letting our carefulness eclipse that?
One way I think about that question is that um, a portion of what body work offers is a sense of safety. I think
Yeah.
of it as maybe a sense of warmth within a structure. And so that structure can provide, at least cognitively, a sense of certainty, a sense of safety that I
Mm.
know when I go to a bodywork professional, that what I'm going to receive, I can lean into because I can feel confident that it's not going to cross a line. It's not going to feel threatening to me. And so I have the ability to lean into it in a way that sometimes people struggle with even within their personal relationships, right? Because relationships don't necessarily have that same structure or offer that same certainty. And so when you reframe the question as what are bodywork professionals good at? How can they lean into what their benefit is? That's where my mind goes first, is they can provide a structured sense of safety where that touch and body manipulation that a client receives can be received, can be enjoyed, can be leaned into for its therapeutic benefit, um, largely outside of that sense of uncertainty or that sense of threat that an affection deprived person may be inclined, more inclined than normal, to see in social interaction.
That makes so much sense that the safety is the context that our work happens. And maybe that's the essence of what we provide. And that structured environment is such an important part of what helps create it. I think in my own maybe personal development, but also in my professional work, I'm really asking the question, what is there besides structure that creates that experience? Because I spent working on ethics boards, teaching ethics courses at various schools, doing consulting in situations where boundaries had been a problem. I'm really aware of how important those are, but I'm also aware of how necessary they are, but not sufficient. In other words, that there is some essence there beyond just having a very structured approach that creates the sense of safety and
Yeah.
affection.
Yeah. I'm not a body work professional, so I can only really address that. I think in the abstract, one thing that I think about is that I have a mental health counseling background, and one thing that is uh, very important and sort of repeatedly we're repeatedly reminded of is the importance of conversation around these topics, that
Mm.
boundary conversation, that benefit conversation. What is therapy? What is therapy not? What is the relationship between you and me as a client and a professional? What is that relationship not? As a therapist, I'm not your friend. I'm not trying to replace that role in your life. This is a very different kind of relationship. And to some extent, there's a parallel, I think, within body work. I know when I go to get a massage that the therapist is not touching me out of affection for me, right? It's that touch isn't coming from a place of emotional attachment to me. It's coming from a professional place, and that doesn't
Yes.
mean that the therapist and I can't have a warm, even affectionate relationship or connection to each other, but that isn't the genesis of the behavior. Where in a personal relationship it is. Same thing in mental health counseling. You and I are talking about sometimes very intimate things, sometimes very challenging things. I'm providing a sense of listening, a sense of feedback, holding space for you. But I'm not doing that because I'm your buddy. I'm not doing that because I'm your friend, the way that somebody who genuinely is your friend might do. I'm doing it from a therapeutic perspective. And so, that structure is important as a starting point. I don't think it's a limiting factor. I don't think it needs to be. And for me, at least personally, many of the most positive bodywork experiences I have been in those therapeutic relationships that do develop a sense of familiarity, where the therapist and I may talk about personal things and I feel like I get to know them, or I maybe even see them outside of that context socially. And so when I go in, what that does for me is not that it changes my framework for what's going on in the therapy room. I don't suddenly then start to think about that therapist as a friend and this physical interaction as something more intimate. What it does is it expands my sense of safety and my sense of engagement in the relationship that I have with that person, whether it's a massage therapist, a physical therapist, a chiropractor, even a cuddle therapist, right? If I have over time developed a sense of closeness and safety with that person, it just expands cognitively for me. Um, the I'll go back to the word boundary that I draw around that relationship in a very positive way. It expands it in a very favorable and meaningful way.
Yeah, you named some important things in there if I continue my inquiry of like what's inside the boundary as opposed to what's out of it.
That's
You
right.
mentioned you mentioned attention. We're obviously talking about touch. What else would we put squarely inside that boundary that makes it so effective?
So I think something else that's in that boundary is a sense of validation that professionals can provide for clients. One of the most valuable things that I can do as a therapist is provide validation for the experiences that my clients are going through. I find it very powerful, for instance, to say to a client, you know what? I think most anyone in your situation would feel the way you're feeling.
Normalizing,
Norm,
validating.
that's right. That's right. And so whether it's a physical limitation that a client is going through or it's their emotional reaction to that physical limitation, I think that that is something that when a boundary expands, a good therapist can provide for clients, is that sense that, you know what you're going through is very understandable. It's very normal. And so let's treat it that way. Let's rather than treating it as something that's coming out of left field. Listening is certainly a part of attention, and I think a talented bodywork therapist also tends to be a talented listener. They tend to be relatively empathic. At least that's been my experience. And also, I think if there's a good sense of safety, if there's a good, what we call in the mental health field, uh, connection to or alliance with that client, we call it a therapeutic alliance. I think something else that can be in that bubble is an opportunity for a therapist to help a client explore new ways of experiencing their body. And that can look different, I think, to different clients, but it can be a way of, I hate to use the term pushing boundaries, expanding clients' experiences in a safe environment. I think of this particularly with clients who have had trauma. And so often with trauma, as you're well aware, one thing that can be very difficult is navigating touch,
Mm.
is navigating being touched, because it can feel very threatening. So once there's a strong therapeutic alliance, even in a bodywork relationship, there's an opportunity there for a therapist and a client to explore, are there ways that we can expand your ability to process touch in a manner that may have felt more threatening to you a month ago, a year ago?
I think that expansion idea is really relevant. I mean, we could simplify it and say that in a reaction that's an aversion or a pain response, we contract somehow our attention, our safety zone, our muscles, and that a lot of our work as body workers has to do with willingness to expand, whether our zone of pressure, like you're describing, but it could be a range of motion, it could be duration. Any of those factors are what we're looking to schmooze, not coerce is too strong a word. You said push, and we took that off the table. It is this invitation or this creating a context where that expansion can happen from the
That's
inside out, from the client side.
an invitation.
Yeah.
And I think it's so important because, among other things, it has implications far beyond that therapeutic relationship, right? Just like validation, just like normalizing, just like listening, providing attention, all of those are beneficial within
Mm.
that therapeutic relationship, but they also have downstream effects on, as a client, say, my ability to engage with people that I'm close to or people that I have emotional attachments with. I may come back to those relationships with a greater sense of self-empowerment, let's say a greater sense of self-efficacy, a greater comfort level to share my emotional experience or to receive touch in an affectionate context because of the work that has been done in that therapeutic alliance.
Anything we know about affection and self-care? I mean, that's such a key factor in the sustainability of what we offer is a client's willingness to treat themselves with affection.
Yeah, can you say more about that question?
Well, there's only so much I can do in an hour or 90 minutes on the table. And a lot of the things people deal with, whether it's on the emotional realm, say loneliness, or the physical realm, say knee pain, come down to be able to listen to oneself and make different choices in the moment. And that
So
practice
I'm sorry, when you talk about self-care, are you talking about self-care for the therapist?
for the client. we'll get to the therapist. Yeah. For the
All right.
client, what role do we have in catalyzing or increasing the likelihood of
I think,
self-care?
yeah, I think a big role is education, is bringing attention to that topic to begin with, because as you,
Mm,
many of us, it's easy to overlook the idea that it's even important,
mm.
let alone realize that we may have to learn how to do it. And so, again, there's a parallel in counseling. We would call it psychoeducation, where in addition to treating you, I'm also teaching you about the struggles that you're dealing with and ways in which they're relevant and things that you can do about them when you're not sitting with me. And I think there's a really strong parallel to that in, say, the massage room, where you can bring that to the forefront of a client's experience and say, in between our sessions, here are some things that you might think about. Here are some things that you might consider as a way to help sustain and build on the benefits that you're seeing from our time together.
There's awareness raising, asking questions about, well, sleep, body movement, things like that can really bring a client's awareness into what is happening in their lives.
Yeah.
Suggestions, psychoeducation, like you're describing, is a really important piece. I have a personal hunch that there's something less or something different than cognitive, non-cognitive we're doing too, where someone experiences themselves as uh, the, the recipient of affection, that they're more likely to treat themselves that way too, just through some sort of expansion of their realm of possibilities. And that's,
Yeah. I would think the same. Yeah, I would think the same. One thing that strikes me about that relationship is that for some people, it may be one of the only spaces where they do feel safe, heard, seen, attended to, cared for in the way that a bodywork professional can provide. Um, and I think to some extent, even if it's not talked about, even if it isn't brought to consciousness in that room, even at a subconscious level, there's a manner, I think, in which I internalize the message that not only can I receive this in a way that's non-threatening, not only is that possible, there's benefit to me to do that. And
Mhm.
so I may internalize that message of, let me think about other ways in which I can replicate this space, this experience of connection, of safety, of feeling seen and heard and validated in my own life. Because nobody can go to massage therapy every day, right? And so I think the more I notice those benefits to myself, I might be able to clue in on my own, even at a subconscious level, that there are other ways, there are other avenues that I might be able to fulfill some of those same needs in my personal life.
We're talking about the client receiving affection. What about the other direction? What about the issues around a therapist receiving affection for our clients? Because that's often the case too. Our clients are deeply appreciative and expressive of that appreciation. But sometimes it seems harder to receive that for practitioners than to give it. What can you tell us about that?
Well, again, I don't occupy that space, so take everything that I'm saying as the speculation that it is.
I think we can assume that a lot of mental health dynamics apply, maybe not precisely, but we
Maybe
learn
not
so much from
precisely, but
it.
I do see a
Yeah,
lot of parallel. Yeah,
yeah.
and and on that note, uh, I think that I sort of have two parallel thoughts here.
Mm,
One is that in both bodywork professions and in psychotherapy, my guess is that there's a certain sense of self-selection into those professions. So, what I mean by that is that I don't think a lot of people would go into massage therapy if they weren't comfortable with touch to begin with, or people going into psychotherapy if they're not comfortable with conversation and with listening and talking about difficult subjects. A certain amount of self-selection probably goes into those relationships such that the people who enter those kinds of helping professions may have a facility with, in this case, something like affection or interpersonal connection with other people that maybe is a little better than average. We may just be a little bit better than the average bear when it comes to the ability to make those kinds of connections. That's one thought, but the parallel thought is that when one spends their day offering massage, doing physical therapy, offering psychotherapy, there also, and I'm again speculating based on my own experience in therapy, there also can be a sense that by the time I get done with my day, the last thing I really want to do is go home and listen to somebody else. Or the last thing I want to do is go home and have my kids hanging all over me or be getting a lot of touch. I might have this sense that I'm kind of touched out for the day. And that can sort of work against, I think, a therapist's ability to get their affection needs met. Now, not in an absolute sense. There are other ways to give and receive affection besides touch. But I wonder to what extent, and I just have to sort of throw this question out speculatively, to what extent therapists in bodywork professions may feel that by the time they get home, I may not really have the motivation, I may not have the bandwidth to be particularly tactile with close relationships in my life because I have sort of given everything I have in terms of touch, or as a therapist, I've given everything I have in terms of attention at the office. So those are two parallel thoughts, and in a way they sort of work against each other. We have this maybe higher facility to give and receive affection, and yet professionally we do so much that is parallel to that. Again, it's not genuine affection, but it's sort of affection adjacent that maybe we don't have as much bandwidth. I don't know. What are your thoughts on those
I'm
observations?
really curious about that. Well, I want to share those, but I'm curious about that distinction between genuine affection and affection adjacent
Yeah.
too. Can we unfold that a little bit, and then I'm happy to share some more. What did you mean there?
What I mean is that the things that we do in therapeutic professions very often approximate the kinds of behaviors that occur in close relationships. So for you, the touch; for me, the intimate conversation, sharing of secrets, things like that. One of the reasons in psychotherapy, and this may be true in bodywork as well, that so many clients have boundary ambiguity, that so many clients start to think of the therapist as a friend and treat them as a friend, as a personal relationship, is that the things that they do with that person when they're together, they only do in their close relationships. And so there might be some extent in which the brain says to you, you know what, you only act this way with your close attachments. This must be a close attachment, right?
Yes.
And so that's what I mean by affection adjacent. It isn't really coming from a place of affection, the behavior. It's coming from a therapeutic genesis or perspective rather than an attachment perspective. But the brain can process it as if it belongs in the same category, because those are the things that it makes us think of. I'm treating you the way I would treat an intimate partner, or you are treating me that way, I guess more specifically. So there must be intimacy here.
That's right.
And it can be
is-
that we in mental health work, we call it transference. So the client starts to treat you as if you are a personal emotional attachment to them.
Yes.
I think probably the same thing can happen in bodywork. So that's what I mean.
Absolutely. And of course, countertransference, where we start to think
Absolutely,
of our
yeah.
clients as intimate
That's right.
partners in some ways. So help me with this though, because this is really rich and important. The difference between genuine attachment and the attachment in the therapeutic context. I guess my way of thinking about it has been that it's all love. There's just a different set of boundaries or contexts
Yeah.
or
Yeah.
ways to manage that around that.
Let me go back to the example I was giving before of massage therapists that I've had in the past with whom I develop something that really does approximate a friendship.
Uh,
So we may see each other socially, or we may talk about our personal lives and things that are going on in our lives in the massage room. Um, that's wonderful as an experience for a client. It makes me feel safer, more secure, more loved and cared for in that relationship. And for some therapists, I really have developed, I mean, genuine feelings
yeah.
of attachment for that person. That's all wonderful, comma, and it should not change what that therapist is doing to me therapeutically.
And what we don't do outside of it.
That's right.
Yeah.
That's right. And I think that's the hook. That's the underlying observation that even if I develop feelings for a client or they develop feelings for me, I still have a therapeutic obligation to that client. And that can't or should not color the way that I go about doing my job as the professional. And it should not color the expectations that I have as a client for the massage that I'm going to receive.
You're making me think one of the fundamental questions in our work is whose needs are being served here, with the obvious answer being it's about the client's needs.
Right. Right.
And then you're also making me think of something one of my teachers would say, Bruce Tift, he would say, the purpose of boundaries is to keep our heart open.
I like that. Yeah.
And we need boundaries that are clear enough, definite enough, structured enough in order to keep the heart open. But the heart open is the point.
That's right. That's right. In order to find safety within that boundary, even if it's expanding, that again, one can really lean into the benefits of that connection, both the client and the therapist. And I think that as long as professionals keep their focus on benefiting the client as it needs to be, I don't think there's anything wrong with the idea that we as therapists also benefit often from that relationship.
Yes.
Why else would we be in the profession if there's not sort of something that draws us, that attaches to us in the work that we do, that feels like it feeds our own hearts, as well as provides the opportunity to be therapeutic for the client.
I'm aware of research that shows benefit to the giver of affection as well.
Oh gosh, yeah. And actually, we have shown in my own research that at least when it comes to health, the size of the effect of the benefit is actually larger for the person who's giving the affection than for the person who's receiving it.
That's that's fascinating.
Yeah.
And I think most of us have experienced a time, or maybe every day, when our practice is really where it should be, of feeling better at the end of the day.
Oh gosh, yeah, absolutely. Absolutely.
And still having the attention on the client's needs, still working within these contexts that lets our hearts be open.
That's that's a perfect illustration of what you were saying, of your heart being open within that structure, so that the structure isn't ambiguous. You know what you're there to do. And because you know that, and because you have a clear sense of structure and a clear focus on the client, you are free as a therapist to lean into the benefits that you receive as well. I think that's a really beautiful thing.
Thank you. Yeah, that's the essence. That's it. A couple other details I want to make sure we can touch on before we wrap up. Your work has suggested that there's a right amount or a right zone of affection, that you can have a deprivation, but there can also be an excess.
That's right.
Is there something you can tell us about that? I mean, you gave the example of like going home, the practitioner touched saturated and not wanting to touch anyone. Is that along those lines?
Well, it is, but that's a state.
Okay.
So I may be touched out today,
Yeah.
but maybe not tomorrow. When we talk about that sort of zone of where touch is beneficial for us, it's really more of a trait. It's really more of an individual difference, such that, I know people, you know people who, seem like they can't get enough touch, like hug me more. And I'm probably one of those people. I would be on the far end of the continuum.
I'm raising my hand too, by the way.
Yeah, exactly, exactly. And there are people on the very extreme other end that are sort of touch averse, and not only do they not need much touch, it's harder for them to process for a variety of reasons. But we all have that zone where, below this is too little, but above this is too much. And one of the key concepts in my theory of affection is that both of those extremes are aversive. It's sort of intuitive for us that getting too little touch is aversive. The sort of counterintuitive idea is that you can have too much of a good thing, that there is a point at which it's not just a sense of diminishing return, it's that actually beyond that point, the more touch or affection we get, the worse off we are. So that
Beyond a point.
correlation
What?
actually changes direction at that point.
Can you give us an example? How does that
Well,
show
yeah,
up in the world? Yeah.
when people, again, it's an individual difference. So you sort of have to know the individual. But yeah, I'll give you a concrete example. I gave a talk on this not long ago, and a woman in the audience came up to me after, and she said, okay, so my husband, I'm always wanting him to hug me more, kiss me more, hold my hand more, put his arm around me more, and he just doesn't. And I've tried everything, and I'm ready to just put my foot down and demand it. What should I do? And I said, well, I can understand why that might seem like a good strategy to
Putting your
put your
foot
foot
down.
down and demand it. Please trust me that it isn't. It won't be for you. Because you need to respect your husbands or anybody in your life. You need to respect that we all have a range of tolerance. And you may have a much higher threshold for something like touch than your husband does. So what's going to happen if you start forcing it and flooding attention, hugging him, holding his hand when he's not comfortable with that, is that induces a stress response in him. It's not stress alleviating in the way that positive affection is, affection that occurs within that range, makes us feel better, makes us feel safer and more loved. It feels like an attack, like an incursion, like he's being violated. If you are forcing that behavior on him, you're inducing a stress reaction, and thus, again, like we talked about before, all of those problems that follow from that. So that is not the right way to get somebody to expand their range, as it were. Now, the good news is that when we've done population studies, the percentage of the population who feels chronically excessively touched is quite narrow. It's only about 4 to 5%.
Compared to 40%, maybe.
That's
on the other
right.
side. Yeah.
So deprivation is a much more common experience. Feeling overwhelmed with affection, not particularly common, and it can be more episodic. I have read some research that shows that this is a common experience for a period of time after people become parents, that there's a period when they can feel like, again, just touched out.
Yes.
I need my space. Mommy needs her space. You kids go somewhere else. I need a period of time when you're not clinging on me, touching me, hanging on me, that I can feel just a little bit overwhelmed. But that tends to be episodic. And after a period of time, we may outgrow that. It doesn't necessarily become chronic for us.
Yeah. That's great. And it suggests to me that the attunement is even more important than the delivery in a way.
It is so much. And um, surprisingly or unsurprisingly, I'm not sure how this will strike you, but we find that in many close relationships and many marriages, for instance, there can be a significant difference in that range, in the higher threshold, in the lower threshold. It doesn't surprise me because, to a very large extent, that range of tolerance for us as individuals is, if not determined by, then at least conditioned by the family of origin, the family that we grow up in. And so I may come from a very affectionate family and marry somebody who didn't, for whom um, touch is just, I don't particularly need it, or it feels stress inducing to me. So I shy away from it. It feels threatening, whatever it might be. Or I have a very high need for it, even higher than mine, where somebody can feel very insecure if I'm not hugging them and touching them constantly. So two people could come together in a relationship with quite a different set of expectations for that.
I think that's probably my personal experience, but also the people I know and talk to. That's very common. And negotiating those differences is a part of what makes a relationship
It
work or
is so
doesn't.
important to do that. Yeah. It's so important to talk about. And it's also so important, I think, for both people when there is that kind of discrepancy to be not only attuned to, but respectful of the other. So I'll go back to the example of the woman in my audience, ready to demand affection. That's not respecting that individual difference in this case, in her partner, but sort of demanding that they acquiesce to your individual difference, to the way that you are. Um, it sometimes it's easy to do that, and sometimes we do that without even realizing it. But being attuned to the fact that we may come into this relationship with very different experiences and very divergent expectations, um, that is just going to be a part of us growing together.
And I think in a client practitioner relationship, we're attuning all the time. As with touch, like how much pressure, how
Constant.
fast,
That's
when.
right. That's right.
And there's also, do you want to talk? Do you not want to talk? All these in the amount of disclosure, all that's being adjusted, listened to and adjusted in a
Yeah.
functioning
Yeah,
relationship.
absolutely. That can be done through conversation. It can also just be done through being attuned to the way that a client's body is reacting to you.
Yes.
I think that talented therapists are highly attuned in that
That's
and adjust on the spot.
people talk about that all the time, how it's amazing on the table when a practitioner, you get it that they feel they're listening to your body.
That's
They
right.
really
Yeah.
get you. You're
It's almost as
learning.
if you're in conversation with the body
Yes,
through a tactile medium.
that's right. And
Yeah.
you, as the clients are hearing us listen to them, and that act is part of what is amazing on the client side
That's right.
of being
Yeah.
acutely listened to, very attuned to. Okay, I heard you mention somewhere a couple interesting thoughts. One, the touch being the first sense to develop, and I'm pretty familiar with that idea. But some say, and you mentioned this, that it's the last sense to degrade or to fade away.
Mhm.
What does that tell us about how essential touch is? Because those are key moments in life, when we first are developing and then our
Right.
exit as well.
Yeah. Well, I think for me, what it underscores is that of all of our senses, touch is the most critical to our survival. So we can, and many people do, live without the ability to see, or live without the ability to hear, or during COVID, many of us lived without the ability to taste or the ability to smell. But without the ability to touch, we would constantly be susceptible to threats in our environment. We would constantly be susceptible to injury and infection, and things that really are life threatening. So to me, that's what that underscores, is that of all of our sensory abilities, the one that is truly the most essential to our survival is our tactile ability.
Very true.
Yeah.
So, and after all your research, all the thinking and writing you've done about this, what do you most want our listeners to remember about the power of what they offer?
Oh gosh, if I have to narrow it down, I'll repeat something I alluded to before, which is that what people in many helping professions, including bodywork professions, offer is something that so many clients may not experience anywhere else in their life. You have the opportunity to create a space that may be genuinely unique in that client's experience. You are the only one who listens to me. You are the only one who is attuned to the way that I'm feeling or responding to you. You're the only one who sees me. And whether the client actually says those things to you or not, it still may be very true. And I found great value in the psychotherapeutic space in reminding myself of that. Even if I don't know it to be true for certain, even if the client hasn't told me that, I find great value in reminding them that this may be the only space where this client feels validated, where this client feels attuned to and seen and cared for. Now, it may not be, but if it is, what a privilege that is for me as a professional. And also, it underscores what a responsibility that I have, what an opportunity, maybe that's a better way to say it, that I have to provide that meaningful sense of connection, of safety, of certainty, of love. We'll go back to what we talked about before, for that person. So I think it's an awesome responsibility in many ways, but it's such a great, if we want to keep our hearts open to a client, it's such a great opportunity to say that whether this is your only space in which you feel this way or not, I'm going to make sure it feels this way. I'm going to do everything I can to help co-create that space for you. So yes, there's benefit in the touch and the pressure and the manipulation, all those things. And also there's just great benefit in the space that we are co-occupying for this hour.
Beautiful. What a powerful ending note. What a powerful touchstone or home base to return to, also for us as practitioners, that if there's doubt or we're not sure what to do or what's helping, returning to that simple affection and being willing to own that word even and describe that to what we offer is a powerful place to call home base to go back to.
I think so.
So this, thanks so much for taking the time to talk to us. And it's given me, and I think probably a lot of our listeners, the encouragement to take that aspect of our work more seriously, the affection piece, and something powerful and worth doing well and something to manage carefully.
Well, let me turn that around and thank you and your listeners for what you do, because it's so important and it's such a great opportunity. So I quite appreciate the invitation to be here and talk about these things with you.
Thank you so much for the time. And to everyone listening, if this has landed somewhere tender for you, I don't think you're alone. That might be exactly the point. Kory's book is The Loneliness Cure, Kory Floyd, and you can find his research at koryfloyd.com. Thanks again for joining us today.
Quite welcome.
This episode was also brought to you by the Academy of Clinical Massage and my co-host Whitney Lowe's newly evolved Orthopedic Medical Massage Specialist program. If you're a soft tissue specialist, you deserve a path to becoming a respected clinical expert with a practice that's both financially rewarding and physically sustainable. That's exactly what Whitney and the Academy of Clinical Massage are here helping you build. Whitney has completely redefined advanced continuing education with a heavy focus on personal learning, an interactive, self-paced path that adapts directly to your unique clinical background, goals, and interests. It's designed to function as a complete practice accelerator system. You'll master evidence-informed assessment protocols, unlock the revolutionary real-time clinical reasoning tools, and build the precise skill set required to solve complex pain conditions with confidence. Visit academyofclinicalmassage.com to start your personalized learning journey. And you can do this with an easy payment plan as well. Whitney would love to have you join, and I can tell you from working alongside him all these years that you'll be in very good hands. Thanks to all our listeners and to our sponsors. Stop by our sites for the show notes, videos, transcripts, and extras. Whitney's site, academyofclinicalmassage.com. That's academyofclinicalmassage.com. My site, advancedtrainings.com. We want to hear from you with your ideas or input about the show. Email us at info@thethinkingpractitioner.com or look for us on social media and YouTube under our names. My name, Till Luca, my co-host, Whitney Lowe. And we would really appreciate it, both of us and the sponsors would really appreciate it if you would rate us on Spotify or Apple Podcasts or wherever you listen, as it really does help other people find the show. So please take a few seconds to go do that. Thanks as always for sharing the word and for telling a friend.